Cook County Health now strongly recommending you wear a mask indoors. Dr. Karen Call from North Shore University Health System is joining us live. Thanks for joining us, doctor.
Thank you.
What determines the level? What determines that we're in medium?
So we monitor the frequency of positives quite closely across the county and across the Chicagoland area. And there are preset numbers that as we supersede, say 5%, we're going from a lower to a medium level of positivity. And unfortunately, we've seen a significant increase in the past few weeks here in the Chicagoland area.
So what does that mean for us now? They've already pulled back the mask mandate. Does that mean to start wearing masks again?
Well, I think the rules are very much the same as we've been dealing with for the past 2 years. We anticipated an increase in COVID cases due in part to travel increasing over the spring break period. We've certainly seen that. And as you point out, the mask mandate was pulled back a bit, and that's also contributing to the increase in cases that we're seeing. So I think it is prudent to go ahead and be cautious, wear masks indoors, and that's being recommended now. Anything we can do to reduce the possibility of spread of this virus is important to do.
So as a doctor, you are recommending that people wear masks?
I wear masks indoors everywhere I go.
Do you still?
Yes.
Okay. Let's talk about this. People can spread COVID for 2 days before they develop symptoms. So that's why it's very important to mask in public, because people can seem okay, but they have COVID.
No, you're absolutely right. And I think particularly now, because we do have other viruses in the area, it's allergy season. It's very difficult to know symptomatic or asymptomatic if you're carrying COVID. So it's wise to be cautious and wear a mask.
And here's a question. We know that people are vaccinated. Many of them are vaccinated. Some of them are boosted. You can still get COVID-19. We need to let people know that, because a lot of people who are getting boosted or even twice boosted think it's okay. Throw off the mask. We can do this. We can do that. You can still get COVID.
No, you're absolutely right. And I think as we learn more about immunity following vaccination or following having COVID, we'll understand more. But it's very true that people still can get COVID. And as we look down the road, we're anticipating additional variants of the virus. And every time the virus changes a little bit, our immunity may be less effective. So it's wise to continue to be cautious around this virus.
So for folks listening, what has changed for the better since COVID was detected in the first place?
Well, I think we know much more now about how to treat people with the disease and how to handle it. And whether it's due to exposures, vaccination, or just the virus becoming a little less nasty, we are seeing many fewer people in the hospital. So the folks that are getting it now tend to have much more mild COVID, and fewer are being hospitalized, fewer are requiring oxygen, and that's terrific news. But we still need to be careful around the elderly, people with other diseases, people who are immunosuppressed. So again, caution is important.
Dr. Karen Call with North Shore University Health System. Be safe, be well.